All right, welcome back to the channel. So what you're looking at in front of you here is some IV catheters. And what we're going to explore today is some differences in the sizes. And we're going to talk about maybe when a certain size would be appropriate over another. Now what you'll see here on the far left is the 24 gauge catheter, and on the far right is the 14 gauge catheter. So these catheters are arranged from the smallest to the left to the largest on the right. So let's take a look at some of these. You'll see here the 24 gauge catheter. If we look at the, at the length and all that, it's a 3/4 inch, 0.7 by 19 millimeters, right? But its ability is to give around 22 milliliters per minute. So let's take a look now at the 22 gauge catheter. 22 gauge catheter times 1 inch as opposed to the 24, it's 3/4 of an inch. And we have ability here of giving around 35 milliliters an hour. Now take a look at your 20 gauge. Your 20 gauge catheter is, again, it's by 1 inch. Similar in the length of the 22 gauge. All right, except the diameter is a little bit bigger, and it allows us to give 65 milliliters per minute. Now we got the 18 gauge catheter here. We have 18 gauge by 1 1/4 inch in length, right? And it allows us to give around 105 milliliters per minute. I don't have a 16 gauge catheter in front of me, but I have the 14 gauge by 1.75 inches, right? So this catheter really is too large for us to be using for IV therapy, but could be done. It allows us to administer 330 milliliters per minute. That's quite a difference as when you compare to that 18 gauge, which is 105 milliliters per minute. Now take a look here at this catheter, how long it is. So this is a catheter that we'd more likely use for a needle decompression and an ALS paramedic level. So we're going to open these up and we're going to look at them and we're going to explore what they look like visually. So stand by. Okay, and so just to kind of continue on this theme, when we're looking at angio catheter or IV catheter sizes versus needs. So when we're going to need a 16 gauge versus a 24 gauge. And so, it's about volume. And let me make these a little bit bigger here, so that maybe we can see the diameter. All right, and so it's kind of hard to see here in this picture, but here we have a 14 gauge catheter right here, and you can see that's a very large diameter. Again, 14 gauge catheters are more or less used for needle decompressions and not for IV therapy. Now they can be if you have the appropriate size, 14 gauge and length. So you could, but most of the time, most services do not use a 14 gauge for IV therapy. So let's take a look at the 16 gauge. It does a large diameter angiocath here. You can see the diameter fairly large. Let's go from there to 18. It gets smaller. And the theme continues, smaller in 20, smaller in 22, and smaller in 24. Let's shrink this back down. And let's look at our chart here. So if we look at flow rates, and these will be a little different than what you have on the front of the catheters that I showed. But if you look at the 16 gauge, so if we look at flow rate to gravity, we have 150 milliliters and about 7 minutes to infuse 150 milliliters. Look at the 18 gauge. The 18 gauge, if we look at 100 milliliters per minute, we're looking at roughly 10 minutes. All right, and so we have a little bit less volume by 50 milliliters, but you can tell that 16 gauge is going to put in a lot more fluid versus an 18. And that theme will continue. We look at a 20 gauge, 60 mils per minute. It's going to take about 17 minutes to infuse that. And let's look at the 22, 35 mils per minute, and look at 29 minutes. So when we're looking at IV catheter size, we can think about age groups. Think about your infants. A fluid bolus there might be 20 milliliters, depending on size. And so if you're looking at the 20 milliliters, the 22 gauge would be fine for that. Or a 24 gauge would be fine for that. But as we start building mass, we start getting larger, so do the veins. And we can look at putting a larger diameter angiocath into that vein. And we're looking then at the 18 gauge or maybe the 16 gauge. So it really kind of depends on the age group you're dealing with and the volume that you might need to administer. The standard medical angiocath for an adult happens to be the 20 gauge catheter. We're not looking to infuse a lot of volume for a medical patient, 200, 300, 400 mils, maybe even 1,000 mils, depending on what we're dealing with, but not usually a trauma patient. So a 20 gauge is kind of the standard medical IV angiocath. At 18 gauge, we start looking at maybe we have a trauma patient. Okay, so when we're looking at trauma or medical blood loss, maybe a GI bleed, something like that, an 18 gauge is an appropriate catheter, an appropriate angiocath. We can get the volume that we might need for an appropriate fluid bolus. A 16 is even better. 16 gauge would be the standard for a traumatic patient, involved in a trauma. We're going to be giving large quantities of fluid or even blood. The 16 gauge would be an appropriate angiocath for that scenario. We're looking at mass. We're looking at age groups. We're looking at what are we trying to accomplish? Are we dealing with a medical patient or a trauma patient? Okay, and so that is pretty much the video. I just kind of wanted you to see how we select the appropriate size angiocath.